Good day friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about the dengue hemorrhagic fever or the dengue fever with some complications. And ultrasound plays a very important role in the diagnosis of this patient. You can see that the gallbladder over here is grossly distended. This gross gallbladder wall edema. If you see it slowly, then you find that the gallbladder walls are grossly distended and they show that they have been separated. The layers of the gallbladder wall, they have been separated from each other. This entire is the gallbladder wall, and the gallbladder wall edema is a sign of hepatitis which occurs in the dengue fever, and there is a diffuse thickening of the gallbladder wall all across the gallbladder from the neck to the fundus. And if you see it carefully, you can see that around the gallbladder also there is edema, and this is pericholecystic fluid collection, which also is a feature of dengue fever. If you take your vision slightly down below, you might find that there is a fluid collection between the diaphragm, this is the diaphragmic, and this is the liver capsule. Between the two there is fluid collection. Over here also around the liver capsule you can see there is some fluid collection on the upper part also, and this is suggestive of ascites. Here the liver parenchyma does not show decreased echogenicity, but the echogenicity of the liver might be decreased because the liver is involved in the dengue fever and there occurs hepatitis. But in obese patients or patients who already have the fatty liver, this decrease in echogenicity may be difficult to ascertain at this time. In good number of patients, the liver may be increased in size, but here the liver size is nearly normal. I come at the spleen and you can see that the spleen size increased. It is 120 millimeters. Normally the spleen is less than 120 millimeters, so the spleen is increased. So dengue fever, the patients may show increase in the size of the spleen and the liver. The kidneys are normal and hypoechoic, suggesting that the kidneys have been excreting normally. But in case the patient goes into renal failure, the kidneys might show increased echogenicity. This is the urinary bladder of the patient, and you can see that there is some fluid in the retrovesical space, suggestive of ascites in the pelvis. This is liver, and you can see there is some fluid collection in the space below the liver, and if I see, then it might find that there is some fluid in the Morrison's pouch, and the Morrison's pouch is the most dependent structure of the abdomen, and the fluid collection generally starts earliest. And whenever you scan a patient of the dengue fever, always scan the chest, and you can see that this is the right pleural space, this is the liver, and this is the fluid in the right pleural space, suggesting that this is polyserositis. Let's see on the left hand side. On the left hand side, this is the spleen, and this is free fluid in the left CP angle, a good amount of fluid. So this patient is having ascites, this patient is having pleural effusion on both the sides. There are three serous cavities in the body. One is the abdomen, that is the peritoneum, second is the pleural space, and third is the pericardial cavity. In case the fluid is present in more than one, that is either the abdomen and the pleural fluid, then it is called as the polyserositis. So this patient of dengue fever is having polyserositis along with the edema of the gallbladder, along with the pericholecystic fluid collection. As this patient improves with time, this fluid might get absorbed. Let's see how does this patient behave. Now you can see that the fluid has got absorbed. The edema of the wall of the gallbladder has decreased in size, and the gallbladder wall thickness is lesser than before. But there is some fluid collection in the abdomen. The spleen has decreased in size, but there is fluid on the left hand side in the left pleural space. This is the picture of the patient another few days later, and you find that the GB wall edema has further decreased, the pericholecystic edema has also decreased, and the spleen has further decreased. But there is some free fluid in the abdomen still present, and this is going to get absorbed with time. The patient has nearly recovered. This is the gallbladder of the patient around 7 days after the first scan, and you can see that the GB wall edema has nearly subsided. The GB wall thickness is 0.44 centimeters or 4.4 millimeters. Normal wall thickness is less than 3 millimeters, so this is also going to get absorbed with time. And if you want to see more of such videos on the various ultrasound anomalies or the other medical problems, please do visit us channel Dr. A.S.K. Gupta Shivam Nursing Home and subscribe to the channel. I hope we have been able to demonstrate a good case of dengue fever with all the radiological findings in a serial manner. In case you like our video, please do not forget to press the like button and subscribe to our channel. Also share the video among large number of friends so that maximum number of people can be benefited. Thank you very much.